Four of our biggest diseases and our biggest killers are the so-called lifestyle diseases: obesity, heart disease, high blood pressure, and type 2 diabetes. For years, doctors recognized that these diseases share many risk factors and even causes. Some even began to suspect that these diseases were in fact symptoms of a larger problem or syndrome. In 1988, Gerald Reaven, a researcher at Stanford University, suggested that these lifestyle diseases were actually various manifestations of what he called Syndrome X. He attributed everything to a root cause: elevated blood insulin levels and insulin resistance. His theories have since been well studied in medical literature. Today, Syndrome X is known as metabolic syndrome.
Metabolic syndrome is actually a compilation of risk factors that have an underlying denominator: insulin resistance. What is insulin resistance? Insulin is typically used to get glucose from the bloodstream into the tissues. If someone has insulin resistance, the pancreas has to work harder to actually get the glucose into the tissues via the insulin. As a result, it cranks out higher and higher levels of insulin to do the job. The excess insulin and the excess blood glucose actually both wreak havoc in the body, and the process is then termed as metabolic syndrome. 5 criteria for metabolic syndrome include: number 1, a fasting blood sugar greater than 99. Number 2, an HDL less than 40 in a male or less than 50 in a female. Number 3, a waist circumference greater than 40 inches in a male or greater than 35 inches in a female. Number 4, triglycerides greater than 150 or taking medication to lower triglycerides. Number 5, a systolic blood pressure greater than 130 or a diastolic blood pressure greater than 85. What is significant about this is that most people do not start medication or are not told that they have problems with hypertension until their blood pressure is greater than 140 over 90. Criteria also include taking medications for the blood pressure, even if your blood pressure is lower on the medication.
Although metabolic syndrome continues to spread, we have the knowledge to stop it. And it boils down to this: too much input and not enough output. More time at the table than time with your walking shoes on. Not only the amount of food we're eating, but the type of food we're choosing to eat is harming us. Along with reducing quantity, we need to focus on the quality of our calories.
Additionally, we find that caloric restriction significantly helps to reverse this process of insulin resistance. Oftentimes people think that caloric restriction just means not eating a lot of food. Caloric restriction simply means eating good food that's not dense. This means eating high fiber, low fat foods that are not significantly processed.
Unprocessed, nutrient-dense food, low in fat and sugar, but high in vitamins, minerals, antioxidants, and fiber. It doesn't have to be boring or tasteless. Not only can these types of foods be delicious, but they'll satisfy you longer, and you'll feel full sooner, meaning you'll eat less as a result. Vegan and vegetarian diets have been shown to reduce the risk of metabolic syndrome because they place a strong focus on plant foods. In contrast, research has repeatedly shown that the consumption of animal products increases the risk of many diseases, including metabolic syndrome. Fruits, vegetables, whole grains, legumes, and nuts, they're the fuels that our bodies were designed to use. Is it any wonder that they all reduce the risk of metabolic syndrome? Besides the energy we put into our bodies, we need to focus on our output. You may have heard it a million times, but exercise is good for you. Besides burning off the extra calories, exercise helps combat disease.
Metabolic syndrome can be reversed. One of the most agreed upon interventions is exercise. We know that a person who exercises at least 5 days a week, 30 minutes, and this is mainly cardiovascular exercise, not just weightlifting or resistance training, which is important, will be able to reverse the metabolic syndrome.
When we choose to exercise and live active lifestyles, our bodies naturally become more responsive to insulin. Exercise also helps us lose weight, and these two things combined mean that regular exercise is a very powerful means of fighting metabolic syndrome. If you have metabolic syndrome or are at risk of developing it, don't wait to start treating it. The lifestyle changes you make will have a tremendous benefit. You'll feel better, be healthier, and happier as a result. I'm Reese Rafferty with Your Life and Health.